Good evening, everyone. My name is Corey Haley, and I will be talking about my personal experience with an adverse case event. So, just to give you a little bit of personal background, I am currently a dental assistant here in Springfield, Missouri. I graduated from Ozarks Technical Community College in May 2017, and I currently work at a general practice here in Springfield, and we do fillings, extractions, crowns, implants, root canals. We do a lot of different procedures at the office I work at. And this picture is the picture that's on our website. And just to describe the adverse event to you all, we had a male patient who came in. He came in for a new patient exam and was diagnosed to have a root canal completed on one of his teeth. He came to our office, which our office is able to offer root canal treatment, and our doctor moved forward with attempting to complete the root canal. However, once getting inside the tooth, sometimes it's a little bit difficult to see from the x-ray what you're going to get once you start a root canal treatment, and we were actually unable to finish the root canal at that visit. So we referred this patient to a endodontist in town, and they were able to fit him in that same day as an emergency patient, and they were able to complete that root canal that day. The patient, at his new patient visit, whenever we diagnosed the root canal, we told him that along with the root canal, he would also need a permanent restoration or a crown placed on that tooth to make sure it would hold together. Whenever we saw him that day for the root canal treatment, we also reminded him at the beginning of the appointment that he will need to schedule to have a crown made for that tooth. Also, after we referred him out, after being unable to complete that root canal, the referral office actually told the patient as well that he would have to return to our office and have a crown placed on the tooth. However, the patient did not return to our office, and the tooth that had the root canal completed ended up breaking off at the roots, and the rest of the roots had to be extracted. So in the area that he had a root canal placed, there was no tooth now. And I looked up an article to let you guys know, and according to Jenny Green from Colgate, large decay and root canal treatment can weaken teeth. So the reason why we complete a root canal is there could be an abscess or infection where the roots are. There could be a really large decayed area of the tooth that has reached the nerve. So a root canal basically goes in and cleans out all of the nerve tissue inside of a tooth. Thus, the tooth won't have any feeling any longer, or it won't have anything alive per se inside the tooth anymore. That's why you don't have feeling as much in that tooth anymore after the nerves are gone. Since the nerves are gone, this causes the tooth to be weaker than how it was before the nerves were removed, because those nerves were obtaining a blood supply from your body. So this causes the tooth structure to be weaker. Also, this specific patient had large decay on the crown portion of the tooth, and that's the part that shows if you open up really big on your back teeth, that's the crown portion. And he had a really large area of decay, so that was removed. So he didn't have a lot of tooth structure left after that decay was removed, and the tooth was going to be weak because of the root canal. This was explained to the patient. However, he did not return to our office and wasn't able to get a permanent restoration or a crown on top of that tooth, and it ended up breaking off because it was weak and there was no protective seal over the top of it. So, what was the outcome? The patient threatened to sue our office as well as the other office we referred him to and harassed us both for days. He made many phone calls, he sent a lot of emails, he made some really pretty nasty Google reviews, and a lot of offices use those Google reviews to share how well their office treats their patients or patient experience. And when he would send emails and phone calls, they would be threatening and harassing us. We tried to explain the situation over the phone again, and he just wasn't taking it. And the very first thing after we learned what had happened is we made sure and we had adequate documentation. So we went, looked, and you can see right here where I'm moving my mouse is this is an example, and this is not the patient's chart. This is just an example of we use what's called Dentrix charting system at our office. There's different forms of charting for the dental field, but we use Dentrix. It looks very similar to this, and you can see notes down here. So we just wanted to make sure that we had adequate documentation for this specific patient, showing that we spoke with the patient about ensuring him that he come back and get a permanent restoration. We also communicated with the referral office, and they had documentation as well that showed where he signed a form that says patient will return and schedule to have a permanent restoration placed on this tooth after the root canal is completed. So both offices had adequate documentation about letting the patient know that what treatment he needed. Sometimes whenever patients can come across this way as harassing, it can be easy to come back at the patient disrespectfully, but as professionals, it's important to us to keep a level head, and we definitely tried to communicate with the patient respectfully and appropriately. And it ended up that we actually had to dismiss the patient. We communicated all the information he needed to know, sent him his records if he needed it. But we actually had to dismiss him as a patient because he was treating our office without respect, and sometimes that has to happen. So, who is responsible? You could look at it from a few different points of view. Is the patient responsible? He had all of the information given to him in verbal and written form, so he knew the expectations of what was expected for that tooth after a root canal had been performed. However, maybe he didn't understand. There was a lot of different communication going on because he expected to have a root canal completed at my office, but we had to refer him to a different office same day. A lot of that changing around and going to different offices can make someone a lot more stressed, and having a root canal done is not fun. So I know that can add to the situation, and maybe there could have been more communication done. Is my office or the referral office more responsible than the other? My point of view, probably not. I don't think either of our offices are more responsible. I think it probably honestly was probably the responsibility of the patient, my office, and the referral office. There are probably different things that we each could have done to make the experience better and to ensure that the patient knew the outcome of the procedure needed to be done. So, what could have happened if no adequate documentation? So, let's say we look back at our notes, the referral office looks back at their notes, and it ends up that we don't have any documentation showing that we told the patient that he needed a crown after this root canal. Well, the patient may have been able to sue if it showed that we did not provide him with any documentation. And maybe that he could have been able to apply what he had been charged for the root canal towards a possible implant in the future. However, we both had documentation, so this wasn't the instance for us, but this very well could have happened if none of that documentation was recorded. Sometimes we tend to say things verbally in patient appointments. However, it's never written down in patient notes or recorded in like paper documentation scanned in. So those are things that both of our offices we went forward with to ensure the patient understands. So what could have been done differently? Our office and the referral office should have provided the patient with a hard copy of information pertaining to the requirement of a crown after root canal treatment. Like I said, many times information is gone over verbally, and we can ask the patient if they understand what we're saying and if they understand what they are required to do next, and they can say yes. However, if you don't show in your notes or in your documentation that you went over this, then it's really hard to prove that it was actually gone over. So ways that we could have changed that, including what we already do, is by putting that information in notes and including it scanned in with a hard copy. We could have sent the patient with a hard copy from our office. The situation was pretty rushed because he had to get over to the other office very quickly. So with time constraints, it was difficult trying to make sure that he had all the information he needed at that referral office. However, to prevent this, even the hard copy could have been given before the appointment started or even scheduled at our office. So let's say a root canal was diagnosed with this new patient. We could have given him a hard copy information of what to expect with a root canal the day the root canal was diagnosed. That way, we can't ever go back and say, well, did we ever talk about this, or did the patient get the right information in hard copy? Because we know that if it's diagnosed, they know what to expect. Now, sometimes if we refer a patient that needs to have a root canal to a different office, then that office is specifically in charge of ensuring the patient knows what to expect with the root canal. Another thing that could have been done differently was the patient could sign a consent form showing he understands what is needed for ideal treatment and the consequences of not completing recommended treatment. So this is something that we utilize in our office, is a consent form, and this is actually something that we had the patient sign the day he got the root canal completed. So this is another documentation form that should be filled out each time. So what to improve upon in the future in the whole system or other scenarios? Patient education is huge. We emphasize patient education in our office every day, before the appointment starts and after it ends. We want to make sure that the patient knows what's going to go on and what's going to happen after the procedure's done. Also, signed consent forms could be implemented. Now, like it says on this PowerPoint, this applies to all procedures. So this could be fillings, this could be crowns, implant placement. This could be any procedure that's gone on in the office. So we just need to make sure that patient education is top par. Consent forms are signed for each procedure, and that there is really adequate communication with the referral office to make sure that we're both on the same page, that the patient that we're referring, that both offices understand what the situation is and what the patient needs to know regards to their treatment, because they're part of the healthcare team as well. So what are we doing now specifically, and not in regards to the other office, but what are we doing? We have implemented consent forms for major procedures. So we had consent forms in place before this specific adverse case event, but we made sure that we had an area in the office that has all of the consent forms ever needed for any procedure in the office, and that we make sure that the assistants, like myself, and the front desk communicate very thoroughly about each patient and see if they need to sign a consent form. Some procedures are, they don't need consent forms signed quite as well. Sometimes we have post-op visits and they're just there for a checkup, or new patient new patient exams, they don't necessarily need to sign a consent form. So we kind of understand what procedures need a consent form and which procedures don't, but we have systems in place that ensure that those consent forms are signed. We have also been working on specific pre and post operative instructions for each procedure. So, like I was saying with patient education, we make sure that each patient, before the procedure even starts, before the patient napkin is even placed on the patient's chest, the procedure ahead of them is gone over and the patient is asked if they have any questions. And then after the procedure is over, we ensure that post operative instructions, so let's say we did an extraction, we make sure that we go over those post operative instructions at least twice with two different people. The first person is the doctor. He goes over the post operative instructions. The assistant goes over the post operative instructions again. And then also, the doctor will go out into the reception area and will go over the post operative instructions with anyone with the patient at that time. So they don't have to relay that information again. Also, the post operative instructions are given in a written form so they can take it home and refer back to it later. Also, we have designed a detailed referral form sent to all offices. So, we have designed a Microsoft Word document that has checkable check boxes on it where we can check box if we included x rays or digital pictures. And we also have a very detailed section on who the patient is, their health history, date of birth, chief complaint, anything applicable to the procedure we're referring them for. And then we have a specific section on what they need to return to our office for. We have the patient sign this, and then we send it to the referral office. So all parties understand what the referral is for. And also, we have updated auto note information. And for those of you who don't know what auto notes are, sometimes notes can take a very long time to write, especially if you have a very detailed procedure. And sometimes throughout the day, there's not a lot of time to sit down and write those detailed notes. So we have gone through and made sure that each auto note is very accurate and includes all the details needed once we click the button to autofill all the information for that specific procedure. And this is the end of my presentation. This is the reference that I used for that Colgate article about why crowns are needed. Thanks for listening, and we'll talk again next time.